Although I firmly believe that we have the best healthcare system in the world, you and your colleagues have taken a position that we have to have health reform immediately. I perhaps just addressed that. If it is so imperative that we have healthcare reform immediately, why does this? Why does this bill not go into effect until 2013? Why? Okay.
Page 14, lines 10 through 13.
He's funny. She's funny. She bored?
If this bill were passed and signed by the President in 2010, which is very fast, it would prohibit abusive practices by health insurance companies rescinding health insurance policies as a way of avoiding covering costs. In other words, as I said, people reaching their lifetime caps, people having pre-existing and so on. It would immediately reduce paperwork and result in immediate savings from that. It would, for some of you have asked about, and this is something I've not talked about, asked about the retiree programs you got. Some of you, some of my constituents, of your neighbors, are early retirees who get to keep, who continue to be insured by their former employer. What happens to them? This would immediately create, in 2010, a reinsurance program so that early retiree health benefits for ages 55 and above would be less, because the company would have the backing of a reinsurance, so that these companies would be less likely to cut you off for your early employee, for your early retirement health benefits. In 2010, it would implement immediately physician payment reforms that would avert a 20% pay cut for physician services. In 2010, it would immediately eliminate cost sharing for preventive services under Medicare and Medicaid. In 2010, it would immediately bring the reimbursement for primary care services in Medicaid up to Medicare levels, and so forth. 1 year later, in 2011, I won't go through all of this. This is many pages. The point is, in 2011, it will begin to fill in Medicare Part D donut hole for those who use the Medicare prescription drug coverage. It will see that the Health Benefits Advisory Committee reports by 2011 on the recommended essential standards for health insurance in America, and so forth. So yes, this would take effect. Each part of it would take effect as is reasonable for that.
That's not what the bill says, sir.
What were you reading there? I didn't see that in the bill.
Sir, page 14, lines 10 through 13. You didn't read that just then, did you? Of course not. Keep lying, sir. Keep lying. It's good.
This, I think, is also... We are better than the mere citizens. Of course not.
Yes, you do. You got Barney Frank telling people, I don't want to talk to you like a coffee table. Sheila Jackson on the cell phone. People asking her questions.
Isn't this a step closer to socialism? In fact, this healthcare system, as I said, this healthcare legislation is based on retaining the American system of employer-based healthcare. I said that probably would not have been my starting point, but that is the starting point of this legislation. That for 75% of Americans, healthcare will be provided through the employer. For some 40-some million Americans, healthcare will be provided through Medicare. And for everybody else, healthcare will be provided through an insurance company, an insurance store that will include Blue Cross and Aetna, and, you know, all of those others. I own a radiology practice that employs 35 people. After the bill passes, and I go out of business, where do these people find work? How does the plan provide coverage without providers willing to do the work? Well, in fact, I think small businesses, and this radiology clinic, even though they consider itself a small business, will be better off if
You've been lowering your reimbursements to me.
If the employees can buy great health insurance,
It's my question.
if the employer,
I want to talk to you.
if the-
It's my question. Can I talk
if-
to you? Can I talk to you?
Not this way.
What can I talk to you? It's my question. I want to ask you a question. Can I speak to
What is your name?
you? Robert.
Okay.
All right, here's the thing. I provide a job to 35 people. I give them all health insurance that I pay for 100%.
Okay.
The government has been lowering my reimbursements, Medicare, for the last 5 years. The Deficit Reduction Act, which you voted for and everyone else, lowered us 35% 2 years ago. Now you're proposing
Actually,
to cut
I
us.
didn't vote for the Deficit Reduction Act.
Oh, that was prior. Sorry. Okay, so now you want to lower us another 23 to 38%
No, this
with
bill-
this bill. Yes, the DRGs are going to lower us to 23 to 35%. I will be effectively out of business.
Okay.
What are you going to tell those 35
sir,
people?
Now, sir, let me give you the facts.
What are you going to tell them?
The legislation
I'm
here,
giving you the facts. I will give you the facts.
thank you, Doctor. This legislation does not change the DRGs. The DRGs are changed by a Medicare panel. This legislation doesn't do that. The diagnostic-related groups. These are the ways that Medicare reimburses hospitals, doctors, those who perform procedures. Secondly, what this bill does do is stop what would have been an automatic 20% payment, 20% reduction in payments to doctors.
What kind
This
of doctor?
stops that.
What kind of doctor?
It
DRGs
stops
are
it.
not doctors,
So-
that's radiology. All those unnecessary tests that I'm claimed to be
but I
doing,
already said
I'm
DRGs
taking
are
care
not-
of. I'm taking care of people.
I understand.
Okay?
I understand.
I do my
DRGs are not
mammography
addressed
for
in here.
Medicare. I do free exams for the community.
Thank you.
I do all that stuff. What is my benefit to become a provider if I'm going to be out of business? What's the benefit?
I think you will be in a better position, sir.
How am I going to be in a better position?
I've tried to tell you.
You're going to
I've
lower
tried
my
to- would you-
reimbursements and you're going to raise my taxes.
Would you please
Go ahead.
Down.
let me answer?
Shut up, because I didn't talk to you.
It
Shut
is-
your mouth.
Boy, I don't want to go to your business.
This bill does not reduce your reimbursement. It does stop a physician, it does stop a cut in physician payments. It does offer small businesses, including probably yours, I don't know exactly how yours is structured, lower rates and assistance in paying those rates. So
My
it seems to
malpractice
me,
has gone up 4
it
times. 4
seems to
times
me
the amount when we
that
started.
you will be better off. If you go out of business, I don't believe it will be because of this bill.
Of course